Assalamu alaikum wa rahmatullahi wa barakatuh. This is Prof. Rima Safadi, the course coordinator of DENT 420, which is the Comprehensive Dental Care 1 course. It is the first course in a series of 3 courses that introduce our dental students to the comprehensive dental care principles. This will emphasize the patient-centered treatment and will also enhance and emphasize and enrich certain skills and value in the students, such as communication skills, respect of the patient clinic time, interpersonal skills, responsibility, and in addition to record keeping and documentation, and many other values while comprehensively treating one patient. In this clinical case portfolio, we will see different sections, but first we need to specify if the student had one comprehensive patient for the comprehensive treatment, or the patient at a certain point of time had to change the main patient to another patient, and this stage will be in the conservative treatment clinic. Now, all students finished the oral diagnosis and the treatment planning and perio-diagnosis and perio-treatment for one patient. Some students could not make it to retain their patient. Some students finished one conservative clinic for his comprehensive patient, but in the second clinic, the patient for some reason did not show up despite all the trials and reminders by the students. So one comprehensive patient means that the student finished treatment from oral diagnosis, treatment planning, perio-diagnosis, perio-treatment, conservative treatment or restorative treatment for 2 clinics, all of these for one patient. The 2 comprehensive patients, it means that at the cons level in the second clinic, the student did not show. But if the student had one cons clinic done for his main patient, it means he finished the requirements for this course as comprehensive dental care. Now, for the oral surgery, since most of the comprehensive patients did not have a need for surgical treatment, so we accepted that the surgical procedure to be conducted on a patient from the waiting list. Okay. Here, the student will provide us with summary and reflection, summary of his case and reflection by his own words, what he think about the patient. For example, in this case, the student mentioned that the dental treatment of my patient went smooth. The patient did not miss any clinic. I communicated with the patient consistently and continuously. Here we can see that the patient had sense of responsibility. The student had sense of responsibility in this case. He consistently and continuously communicated with his patient. So the core values, the soft skills, the interpersonal and communication skills will be learned or practiced throughout this course. The outline of this portfolio had about 13 steps. The first one is the patient name, file number, and demographics with a screenshot from the DPR. The screenshot just to show us that the student is documenting everything and he is learning the record keeping, learning and practicing the record keeping. Here for the patients, we have a space for 2 patient names and file numbers in case the student had 2 patients. Of course, the consent form needs to be signed and uploaded. And here we start with the patient selection criteria. The student needs to write the selection criteria for all patients if applicable, meaning if he had more than one patient, we need to know the selection criteria. Okay, let's go to the oral diagnosis history taking. After selecting the appropriate patient, then the oral diagnosis process started. History taking, all components of history taking, starting from the chief complaint, history of chief complaint, medical history, dental history, family history, and to the right side here we see the screenshots from the DPR for documentation. Extraoral examination with all the findings and screenshots from the DPR. Intraoral examination, soft tissues, and documentation. And this is the examination sheet as we still use it in the clinic. I ask the students to provide it here to show their details that they performed the procedure. And in this case here, we need to write, let me check here. Okay, so we have referrals for oral surgery, for cons treatment, for RCT, and the diagnoses included multiple karyocytic gingivitis and calculus. The patient is also referred to prophylaxis in the period clinic. Okay, here we left a space, a short space for the student comments. Extraoral photographs. Now the intraoral photographs and charting, upper and lower, maxillary teeth, mandibular teeth, and here is the detailed restorative diagnosis for the upper right quadrant. Here we will have a diagnosis quadrant by quadrant, including the clinical photographs and the radiographs. In addition to the pulpal and periapical diagnosis, we need the radiographs and to list the tests of the pulp vitality and the periapical preapical test, let us say, which is the percussion in this case. We use also cold test, and then we will give the pulpal diagnosis and the periapical diagnosis. This is not done for all the teeth, only the teeth indicated for such diagnosis. And here we have the list of comprehensive oral diagnoses steps, all the steps performed. It looks redundant, but it is not actually. If we look to the right side here, we see that which radiographs were ordered, and the student selected 4 of them. These are the radiographs that were ordered, if you want to know. Dental charting. Here we did charting of the remaining roots, charting of different types of dental caries, charting of different types of fillings. All of these types of charting were done for the gingiva also, or for the periodontal status. Charting for the gingiva was performed and the other components. This served as a checklist for the student to follow, as just not to miss any part of the examination and oral diagnosis. And here we leave it to the student to reflect on his case, on the oral diagnosis process he has performed. Now the dental treatment plan that falls actually into 5 phases: the systemic phase, acute disease control, definitive phase, and the 5th phase is the maintenance. And the 5th phase will be left to the 5th year students. Here, the treatment plan is itemized and phased. Itemized, it is like categorized into types of treatments, like teeth needing extraction, teeth in need for RCT or re-RCT, fillings, crowns, bridges, removable partial dentures, and then all of this is placed into the phases. By this, the student is practicing and repeating the treatment plan in different ways so that he gets used to this way of treatment or planning of treatment. Again, the phases are clarified, detailed, and written in a, let's say, more readable format. Okay, we need documentation, we need record keeping. So the treatment plan is inserted in the DPR, and that is the screenshot. Now, periodontal diagnosis and treatment. The student will start with the periodontal charting. We are in the process of automating also the periodontal chart into the DPR, but it is not finished yet. So the students still use these forms and we ask them to give us a screenshot. Again, for the periodontal diagnosis and the risk factors. And this is the documentation of the procedures taken. Here we see that the code used for new examination, this is for perio examination, and then the upper and lower jaw scaling as it is requested by the students. Now, the restorative treatment, clinic 1, indicate if this is the comprehensive patient or the second case or the second patient. In this, why we are doing this? Because we requested from the students to at least have 2 procedures performed for the comprehensive patient to consider the case as comprehensive. So most likely the clinic 1 or clinic 2, the student must have his comprehensive patient to fulfill the requirements of a complete comprehensive care dentistry portfolio. So here the student had 2 fillings placed for 1 tooth in his comprehensive patient, and in the second clinic, okay, so this is the first clinic, but again, this is the first clinic and this is the documentation in the DPR. But in the second clinic, the student had 3 teeth restored for the same patient. And this is the DPR. Now, oral surgery clinic, as we mentioned, not all comprehensive patients will have surgical procedures. So this part is not considered as part of the main comprehensive case for the student. At the end, we need summary of all the codes, all procedure names, all teeth numbers, clinic, supervisors, day and date, summarized by the student in this table to show his progress. At the end, the student will show the pictures and will write about what he has learned and how was his experience, what he is looking for in the coming academic year. And thank you.